incident management plan. I shared with you a PDF, and PDF basically has an outline of what you need to have in your paper. So the injury management plan has the situation that occurred that caused the person to get injured. So it's just kind of a made up scenario. You're going to have signs and symptoms of that particular injury. So you want to include that in paragraph form to encapsulate all the issues that come with that particular injury. And then you're going to build 3 phases. And you need to think of the phases as timing. So phase 1 is 24 to 48 hours after the injury. Phase 2 is 2 to 4 weeks after the injury, and phase 3 is a month to 3 months outside of when the injury occurred. So all your goals and therapies and exercises for phase 1 are going to be basically focused on getting rid of pain, discomfort, and swelling. So as you know, if you've been injured before, the first 24, 48 hours or so, it's pretty uncomfortable. So all the goals here are basically to mitigate and get rid of pain and swelling. So your therapies are going to be tied to how does one get rid of pain and swelling. Anti-inflammatories, the RICE method, rest, ice, elevation, compression. You could have immobilization occurring. You could have something as severe as having to take pain medication. So all the therapies are in around trying to get rid of swelling and ultimately pain. Exercises, might be hard to come by for phase 1. Person's in a lot of pain, discomfort, a lot of swelling, can't really move anything. Some of you are going to have a little more ability to have some exercises occurring. Somebody that gets a hip transplant is basically up and moving usually 6 to 8 hours after surgery, just to kind of keep blood moving in that direction. So it might be just something as simple as walking as an exercise. Phase 2 is the repair process, and repair means that you get the joint range of motion back. So this is something that you have gotten rid of the acute pain. You might still have some swelling to deal with, but now what you're trying to do is stretch out the muscles, the tendons and ligaments around the joint in order to get range of motion back. So initially you have a lot of stiffness, but over the course of this particular phase, how do you get rid of that stiffness? So goals here are always going to be in and around increasing range of motion. Therapies are going to continue to be, you're not going to do ice anymore. Ice is only beneficial in the first phase. Now you're going to add some heat to the area to increase circulation and repairing. Electric stim is used. Electrodes are placed on the area of pain or where the injury occurred, and electrical impulse is sent through the area, contracting muscles around the particular site of injury, which increases blood flow. A lot of these are going to be avascular tissues, tendons and ligaments that need blood supply in order to repair quicker. They don't have it on their own, so you need to get blood pumping to that area. Exercises here, therapies also might be bracing, casting, things like that, kinesio tape. Exercises for phase 2 are going to be body weight. So you're not going to the gym and racking 400 pounds on the squat machine and dropping huge weight with your weight belt on and chalk on your hands. This is all about just increasing range of motion, your own body weight, moving that particular joint in particular areas, angles to increase mobility and get rid of stiffness. Phase 3 is what can you do for that person so that the injury never happens again? So this is building strength and flexibility in the particular site. So the goals here are always going to be increasing flexibility and strength. Therapies, you might continue to wear a brace here, but you're getting rid of a lot of the anti-inflammatories and pain medication, heat, as well as some of the major constricting braces. So this might be more of a sleeve, some types of Graston techniques, massage therapy, things like that. Exercises. So this is the person going into the gym and they are on an exercise plan to build rebuild strength in that particular area so they never get this injury again. Okay, so that's the paper. Situation, signs and symptoms, 3 phases. First one is first couple days. Next one, 2 to 4 weeks. Last one is 1 to 3 months. Then what you're going to do is you're going to build a PowerPoint, super, super simple, no real words, a lot of visuals. So basically what you're doing is you're taking your paper and making a visual of it. I gave you an exemplar of what the paper should look like. So this is the format, title of the injury, the situation, type that out, signs and symptoms, paragraph form, and then you break it down into the 3 phases: the goals, estimated time, therapies, exercises. And you just repeat that process through phase 2 and 3. And at the very end, you have a criteria for return. So what does the patient need to exhibit in order for you to give the stamp of approval for that person to get back to what they were doing before without any issues? Okay, so that's what it looks like. Here's some exemplars of students in the past. This is the paper look like, the tear, situation, signs and symptoms all typed out. Phase 1 all typed out, goals, estimated time, therapies and exercises, and at the very end, criteria for return. Then the PowerPoint, it's not the greatest example, but title slide, and then injury situation, signs and symptoms. You want to include a picture of the site that's been injured. Phase 1, he doesn't really have a lot of pictures here, or would like to see more. So you want to, grasping technique is mentioned here. What is that? Okay, so show a picture of it. So the PowerPoint is the patient needs a visual of what you're talking about. So you might tell them to do a Bulgarian leg squat, and they have no idea what that looks like. So you should have a pictorial representation of your management plan. That's your PowerPoint. Again, minimal words. You're not retyping your report. You're just providing picture examples of your therapies and exercises. Here I mentioned stretching, but no pictures. Okay, so you want to include pictures of that particular item. Here, a little more, pictorial representation of what needs to be done. And then, so that's all body weight in phase 2. And in phase 3, obviously, you're hitting the weights and building strength in that particular area. So this is due next Thursday. I'll be around. Obviously, I'm not going anywhere. And if you have any questions, you want me to read things over, help you in any way, always feel free to reach out. And hope you're all staying healthy and relatively happy. And I'm sure we'll see each other soon, very, very quickly. Stay safe.